Ironically, the very next day, excessive rains and very high is growing property drops and killing scores of people. As a result, small farmers and forests, they're extremely unpredictable, both in terms of scale and also time. So adaptation measures to be less than by 2100. 3 out of 4 people will be subjected to at least 20 days of extreme or inhuman days and also nights. Currently, that figure is 1 in 4. And even if we are the elderly, economically disadvantaged, and those with chronic. Now, Lead Pakistan has been working with the government, communities, and organizations. Now, we've been developing early warning systems about a few years ago. This was in 2012. World did in a very elaborate regional toolkit to City, Foundation, John Hopkins, and ELRA in preparing communities and hospitals for Senator Sitara Ayaz. Unfortunately, Senator developments on the political front. But I hope this will be a great learning experience for us all, just to see how we can all contribute.
His postdoctoral toxicology training from Johns Hopkins University, Baltimore. He is the principal.
Thank you, Salima, for the kind introduction. And professionals, experts from climate department, NDMA, and our collaborators from Dr. Nadeemullah Khan, and it's my privilege and operates on core principles of quality, relevance. With this, I would like to thank you again for taking out time from your busy schedule to participate in this dissemination meeting. Thank you.
For kind welcome. Dr. Junaid Raza to share his insight and learning from the HEAT project.
Rahim is to briefly introduce the project, and we know that weather-related disasters and trying something we used to think a lot about, even though we live in Karachi, of course. Also, the numbers are 94 million people affected, a major contributor to maximum temperatures, because that difficult and dangerous territory. We had community peace, we had hospital peace. We were studying in the community all high-risk patients. Sorry, it's not projecting very well. And we were hoping that our strategy would reduce the number of cases of heat emergencies in the community. Through early diagnosis, these patients will then go to the hospitals, and in the hospitals, physicians and nurses will do early treatment. So just living in the cities, and we were medium to large cities, in temperature.
Toxicology from Johns Hopkins University, and he's the principal investigator of the HEAT project at Aga Khan University. Welcome, Dr. Nadeem. And devising way forward, I would invite upon the stage Dr. Nadeemullah Khan, Associate Professor and Consultant, Department of Emergency Medicine. He is a diplomat, American Board and Internal.
There were two distinct studies, and there was unfortunately not as much patient overlap as we would like to do because of the referral patterns work in a city like Karachi. So our study will, we feel, will fill the critical gaps in research. It is the first randomized controlled trial in this area in a low-income urban population. And we hope that we will learn some lessons, and there are a lot of questions that will come out of it. I'd like to thank Lead Pakistan, of course, but also on behalf of Hopkins, the Aman Foundation, AKU, our implementation partners in Karachi were JPMC, Sindh Government Hospital, Korangi, Indus, which is a private-run charity hospital, and Al-Jiniot Hospitals, again a private hospital with serving low-income population. We had on our advisory group people from Med Department, Engineering School, the disaster management, the media, and the healthcare. We were funded through this organization called ELRA out of UK, which is supported by DFID and Wellcome Trust. So with that, I would
on managing heat emergencies. And this training was after a thorough literature review and evidence-based search on the available literature. We also did a discussion with emergency care staff to find out the perception and barriers in dealing with patients with heat illnesses. And I'll tell you the findings of this before. This was the method, how we enrolled patients. So patients who presented to emergency department of any of the participating hospitals, they were registered and then approached by our research team. And then they explained the patient about the study and asked consent. And then they collected data on its demo 2017 and 18. And we targeted heat months from May to July. Countries was lacking as described by Dr. Junaid also. So the project aims was to improve patient care in emergency department through evidence-based heat management. What lessons we learned from Karachi. So before starting the project, we identified this gap in research. We found out the response to public health. These 2% were enrolled, which were 8,203. And this is the population that we covered. So in 2017-18, the total ED visits at a point of concern, it was reaching the extreme heat definition. Definition of heat stroke and heat exhaustion in the literature, there was a lot of variability. Then there is also need for better disaster preparedness at all the hospitals level. And then they also felt that there is lack of availability of life-saving drugs in emergency departments during those disasters. Anyway, so fever, nausea, vomiting and headache are the 3 most common symptoms in this population, which is indoor. Although we suspect that outdoor will be more exposed, but the study showed that this is the demographic characteristic of patients who were diagnosed with heat illness during this time period, and the least one was 10-bedded. And surprisingly, you see lower down the 10-bedded.
In these community sessions where we invited 2 people, basically the head of the household and the spouse or the partner from each household. So approximately 60% of the population from this community, from the case side, attended these awareness sessions. While these awareness sessions were being conducted, at the same time, community mobilization was already being done at the door-to-door. This intervention was designed for 2 months. There were 20 individuals per session attended, and session was designed was through awareness sessions and community mobilization. Community awareness session.
Bismillahirrahmanirrahim. I just want to correct you first. You said Prime Minister of Khyber Pakhtunkhwa. We don't have right now a Prime Minister at Khyber Pakhtunkhwa. I wish we have different Prime Ministers in every province. Thank you very much, Lead. It's a very important issue, and everywhere, internationally, it's a very important issue, and it's very unfortunate that not here in Pakistan. But some of our organizations, at some forums, we are not taking this issue, and I'm very thankful to some NGOs and some other forums who are working and giving awareness to our people regarding this very big issue. As all of you know that Pakistan is one of the 10 countries, and I guess it's now on 8th. It's not 10, it's 8 now. Global Climate Risk Index, we are on 8 numbers. So one can imagine that how we are right now, this country is. Though we are facing a lot of challenges right now, and one of challenge is global warming and climate change. When we talk about climate change, it's not only heat waves. Actually, it is the melting of our glaciers, the deforestation, and so many things is here. And right now, I myself actually working on this glaciers, because I visited and I saw that how much we are actually going to waste our water, and then we don't have any reservoirs, even the small reservoirs over there. And then the Pakistan and India, what we are doing on our borders of these glaciers and Siachen Glacier and other glaciers, they are melting like anything, and it's going to be a disaster for both the countries. But it is unfortunate that we don't understand this. Recently, I was in Wilton Park, Sussex, and it is again so unfortunate that we, three senators, we were there in Wilton Park, and our other South Asian countries' representatives were also there. And the things which we were hearing for the first time in that conference, our neighbors, they are already working on that. They understand the sensitivity that how important this thing is. Like India, they signed the Green Grid connecting South Asia, which is the latest technology to stop the fossil fuels and all these things. And that was for the first time we were hearing these things. That, okay, this is also something which world now is thinking about. And the Europeans and Americans and all of them, they are working. And India already signed that in Paris. And where were we at that time? I don't know. Maybe we were busy in this petty politics somewhere. And the important things, we are not concentrating. We, in June 2015, the Karachi experienced severe heat waves. We know that what happened there, and it was like 1,200, if I'm not wrong, it was 1,200 deaths because of that. Now one can see that every time there is alert of severe weather, of severe wind, and it happens in Sindh and Punjab also. All the, I think the mangoes and our other Punjab farmers, they suffered a lot because of those winds and severe weather. Now the thing is that there should be now a way forward. We have to move forward. We have to work on this thing. You all, I'm not expert, but you all are experts here. And we are learning from you. We are the learners right now. And it is our job, I must say, and I've always said that yes, there is a weakness somewhere in the parliament, somewhere in our political leadership, that it is not even on our agenda of any political party. When we are giving our manifestos, there is nothing regarding this climate change. In any party manifesto, if in election time, during election time, all of our parties, they are giving their manifesto. There is no such thing. We all should try for this thing. Political awareness is very important because we believe in democracy, and we want democratic governments to take steps and to save this country from all these things. We have to, well, there is this government, though I'm not a part of this government, I'm in opposition, but what I'm hearing is that they are working on billion tree tsunami project that was in Khyber Pakhtunkhwa. I don't want to criticize anyone. There is a lot of problems they might be facing, but the sustainability, we don't look at the sustainability. Either what we are spending right now, is it sustainable? Is there any mechanism to look at those trees which we are giving to people? What's going to happen? So that is a thing which the government has to take care of. And along with, again, I always said that the governments, they cannot do all these things. We, like all society, they should work along with the government. Every successful project, if we look at the history of every successful project, it is the people, general people, when you take them along with you, then it is successful. The same is with this tree plantation, billion tsunami tree plantation. When I started working, this is on my own choice. When I went to the chairman senate and I asked him that I want to this climate change committee. That was totally dead committee. 3 years I was a member of this committee, but it was a dead committee. We only visited Karachi for mangroves and all these things, but there was nothing. Now our minister, Zartaj Gul, again I am not a government, but I must praise her that she is also trying to learn. She is also trying to do something. At least she is trying. At least she wants to learn something, and she is trying to implement also. So again, I don't want to say any political, I don't want to give any political statement, but as a politician, again, I must say that a woman, she's a woman and she's much more better than right now in a cabinet from men who are there. So at least she's doing something. So we gave her surety that we are with her, the opposition will be with her on this issue. I just want to share what we experienced. We also went to Karachi and we went to a seaside, and then we asked the Sindh government about the sea situation, the Karachi harbor. It is in a pathetic condition. If you go to other harbors, other countries, you will enjoy that. But if you go to Karachi harbor, the smell, what they call that plastic bags, plastic bottles, everything is there in that sea. So the report, which is like, I mentioned that somewhere in a committee also, that they said that yes, we sent this seawater to the laboratory for test, and they said that ये तो गटर के पानी से भी गंदा है. Just imagine the Clifton, where people are going. So this is the situation over there. All the Karachi, this ganda is going into that sea and not treated. So imagine the people who are going there. How? Think about their health. We were just looking at this whole medical thing, and just think it's in a normal routine. If these people are going to there, what will be their health condition? Then come to Islamabad, and then our EPA, again, it's a woman and she's doing very good job, but she doesn't have a staff. She doesn't have, she has only one inspector who is taking care of all these hospitals, hospital waste. So just think that one inspector, how come he can go to all the hospitals in one day? So the hospital waste, where is it going? We don't know. It's going for recycling. Who is taking care of that? No track of that. I heard that in Punjab there is small industries where they are making these milk bottles for children of these hospital waste. So again, think about that. We are always complaining, I must say, that all the governments, whoever in the government, that we don't have a budget and health is, we are giving the least priority to health all the time. But if we concentrate on these issues, there will be no health problem. Health problem will be there, but we can minimize that. So a lot can, I think we can do so many things, but we need a will for that. And that is a political will, I must say. And I hope that with all of your support, who I really respect all of you, because I feel that I'm nothing in front of all of you. You are the one who have experiences. You are the one who are working in the field. You know how you know even the solutions of all these problems. You can come up, and you do actually. Many of you, they come and give solution of that. And I pray and I hope that we'll be able to implement that. We are trying, as I said, that as far as climate change, and especially now we are concentrating on Islamabad, because I, in a Senate, after 18th Amendment, I cannot go to the provinces. I can just, like our government, our committee can send our advices, we can share our reports with them, but they are the one who are going to implement. And the same here, but over here in Islamabad, we can even help them in implementation. So we are working here in Islamabad right now. We are working now with some NGOs. Even I was so happy to see that day some young boys and girls, they came to my office wearing shirts of Tehreek Islamabad, and they said that voluntarily we are willing to work for with your committee and with the ministry for awareness of people, to tell them, because our people are also, they are not aware what they are doing. We clean our houses, but we don't clean our cities, we don't clean our mohallas, we don't think about those things. If you look at the Nala over here, which is coming from E11, from the Margala Hills, and if you then come to the Sunday Bazaar over here, and if you look to that Nala, it's like all the time I'm always screaming. Actually, I'm a person that always go to the Sunday Bazaar every Sunday, so I know that what's happening there. So now the CDAs, I'm always sending them in writing also. So now they started cleaning that. But if the people involved in that, if the local people, they showed their interest. So it is very encouraging that now the young boys and girls and the other people, they are coming out and they want to do this thing, because everybody, I think, even in Islamabad at least, they know that how it is going to be a problem in the future for our generation. We want plastic-free Islamabad. That also we are working on it. We are able to have now glass bottles, at least in the Senate, in Chairman Senate office, Deputy Chairman Senate office, and in our committees. Now we stopped plastic bottles, and we are using either in jugs we are having the water, or the other bottles we are using. But at the same time, we stopped some of the work over here in Islamabad, when there are so many buildings they are making, but they are not environment friendly, so we stopped that also. The few small things we started, and I wish and I hope that we will be able to make this country peaceful. Yes, in fact, that is more important, peaceful country, and a good environment for our children, clean drinking water, that we can give a healthy generation to this country. Our population, you know about it. So that is, again, a very, very big issue, but I must commend LEAD and Aga Khan University for organizing this seminar, and other also, because I read so many reports of LEAD, and there are other seminars and workshops what they are doing. This is something which we really need right now, and this is I think a very pressing issue, and mobilizing the stakeholders from a different sector on a common agenda, and that is like climate change. I think you are doing a commendable job, and again, thank you very much. As I said, that I'm not very technical, but I really, this subject is very close to my heart, and whatever I'm doing for my next generation. I'm doing for my own children who are going to live whatever life we spent here. And I think we spent a very good life in Peshawar. I remember Peshawar University and all. That was a golden time, and now my children, they are missing that. What we spent. So we really want, we all have to work together. And I personally said that whatever I'm doing, I'm always thinking about my children and then the children of my country, that we should give them a good, healthy environment. Thank you very much. Thank you very much.
May I now request Mr. Dr. Nadeemullah Khan, Consultant Emergency Medicine, Aga Khan University. Mr. Zahir, valuable time, experience and knowledge. May I request you to stay back on the stage and give away a few more souvenirs? May I also request Dr. Junaid to stay back?
The intervention site was visited 4 times in 2 months. So average 13 households per day were carried out by the Aman community health workers. Now what actually happened from the intervention and how did we do it is through these brochures that I have in my hand and also in the welcome pack that's on your tables. So we developed these brochures in collaboration with Johns Hopkins University and Aga Khan University and of course with the advisory group of this study. 6 major themes.
We will now break for 15 minutes for the tea and care and Professor Emergency Medicine, International Health at Johns Hopkins University School of Medicine. Thank you, Dr. Junaid.